Welcome to the TrialSite News Roundup. Today on our episode, we're going to be talking about the U.S. poison control ivermectin data, which we at TrialSite News have analyzed. Now, this is important as there have been a rash of stories on the subject lately, including the Rachel Maddow Rolling Stone debacle, where outright false information circled the internet before a correction was issued by the Rolling Stones. So, in this episode, we will take a look at actual data from the American Association of Poison Control Centers and tell you what it all means. And so, from TrialSite News, I'm Adrian, and our episode starts now. So, the U.S. Food and Drug Administration, or the FDA, the Centers for Disease Control and Prevention, or the CDC, and prominent physician and pharmacy societies have stepped up and intensified warnings about the use of ivermectin across mass media. Now, while a recent American Medical Association warning press release cites a huge rise in ivermectin prescriptions and a threefold increase in calls to poison control centers associated with the misuse of the generic drug, no context nor data is offered. Now, in their report, all of the prescriptions are associated with physician prescriptions to consenting patients for the over-the-counter use of ivermectin. Then there is the improper use, which involves the procurement and inappropriate use of the animal version of the drug, which media messaging often appears to conflate these two distinct use cases. Now, as we here at TrialSite News recently reported, the American Medical Association, or the AMA, prominent pharmacy societies, and one of the makers of ivermectin, Merck, has declared war on the economical generic drug that has treated over 4 billion people prior to the pandemic, all the while helping to manage diseases such as river blindness. Now, we have noticed a trend where mainstream media parrots, seemingly without any critical questioning, what the various government agencies like the CDC have reported. So, for this episode, we'll be talking about the Association of Poison Control Centers, or the AAPCC, and their report that calls to poison control centers grew threefold over the pre-pandemic baseline. And this is important because you also have the FDA in the past issuing warnings against the use of the drug, while providing no data to the public backing up their warnings. And we here at TrialSite News have been on the record asking the question, what is the baseline? And thankfully, we were able to secure the actual AAPCC data. Now, what we found makes it clear that the situation appears quite different from what government authorities, medical societies, and mass media are proclaiming publicly. There is a significant chasm between the media and government messaging and what the reality is when you look at actual data. So then, what does the actual data indicate? Well, the data used for this analysis originates from the American Association of Poison Control Centers, or the AACPP, and the National Poison Data System, or the NPDS Bulletin. There were 1,143 ivermectin exposure cases reported from January through August of 2021. Now, this is an increase in cases compared to the year prior, or the baseline data, of 435 such cases. Now, given the dramatic increase in physician prescriptions of ivermectin, which is at 2,344% from the same time period last year, this number then should have been expected. But what about the CDC's claim of reports of severe illness? Does it hold up to the actual data? Well, the breakdown of the ivermectin poison control calls by category looks like this. Out of the 1,143 calls, there were 0 deaths, 11 major effects, 91 moderate effects, and 148 minor effects. Now, based on a review of the data, only 22% of the total show any material effect whatsoever. The vast majority of the case calls, or 78%, fall under the category of no problem or an aggregate labeled as not sure, and thus required no follow-up. Now, clearly, in these latter cases, any real threat to consumer safety would have been flagged for follow-up. So, 754 out of the 1,143 cases were classified as no effect, non-toxic, or minimal. 137 of the calls were potentially toxic, but with no follow-up. Now, this category indicates that there was nothing severe going on here. Calls deemed severe equaled 1%, or approximately 11 cases, and none of these were classified to the media as self-medication-based abuse of the veterinarian drug. And then, when you take this data and compare it to the magnitude of growth in the use of the product since the baseline, overall ivermectin prescriptions have soared. Prescriptions rose from 3,600 per week pre-pandemic to 88,000 per week ending August 13th of 2021, representing the 2,344% increase. So to put this into context, let's take a look at hand sanitizer, which Poison Control fielded quite a few calls on prior to the pandemic, or what we would refer to as the pre-pandemic baseline. Now, these calls increased 58% from January through August of 2019 to January through August of 2020. These calls increased 58% from January through August of 2019 to January through August of 2021. However, 3,320 of them were major, moderate, or minor effects, while 4 people died, according to the CDC report. Now, for comparison purposes, poison control data implies that methanol-based hand sanitizer is far more dangerous than ivermectin based on the calls to the 55 poison control centers over the past year, given the handful of deaths. Now, critics have suggested that perhaps there is an agenda to all of this. The FDA and CDC, according to ivermectin proponents, have vilified the drug by association with misuse of animal versions of the drug, such as horse paste. Importantly, the rise in prescriptions to 88,000 just last week were all doctor-prescribed, non-animal, non-mail order ivermectin. In other words, the human version of the FDA-approved drug used off-label for the indication of COVID-19. Meanwhile, several countries, including India, for many months authorized the use of ivermectin as a treatment for COVID-19. And as we reported on TrialSiteNews.com, the tremendous turnaround in Uttar Pradesh, India's most populous state with over 220 million people, where a statewide public health, home-based care program involved both frequent testing, home isolation where possible, and medicine kits which included ivermectin. Now, this effort was associated with a dramatic reduction in COVID-19 Delta variant-based cases. Now, while we here at TrialSite News have been on the record stating that we cannot prove that the ivermectin correlates to the dramatic reduction in cases there, the effort, however, certainly caught the attention of the World Health Organization, or the WHO, who celebrated the effort. But the World Health Organization opted not to mention the use of ivermectin when discussing the success against the Delta variant-based cases. Now, while all of this goes on, a clashing point of view has been unfolding in real time, as nearly all of the 63 clinical trials involving the drug revealed positive data attributes, indicating a case for off-label use given the drug's known high safety profile for the intended use against the virus. However, the opposing view against the use of the drug against COVID-19 off-label represents a great majority of the nation's regulators, public health, and physician societies who resist the acceptance of the drug, emphasizing that out of the 63 such trials, only a handful are worth reviewing, and the ones showing any positive data aren't reliable due to the study design, dose variation, and so on and so forth. Thus, this dominant point of view posits that there just isn't enough data to merit approved use. But currently here in the US, off-label use is legal, and that just may be what is the latest intensified campaign seeks to change. And so it seems that the long knives appear to be out against this drug, as daily messaging via the mainstream news media is repeating over and over again the threefold increase in calls to poison centers due to abusive self-medication, all the while appearing to conflate the use of human ivermectin prescribed off-label by a licensed doctor to a consenting patient and the misuse of the animal variety. Now, as pointed out by Dr. Ron Brown in a recent op-ed on TrialSiteNews.com, he wrote about the growing media trend of conflating physician-prescribed use of ivermectin with dangerous abuses involving use of the veterinarian version of the drug. Dr. Brown puts forth the question that, is it possible that the media is purposely confusing the two very different versions of this drug? Food for thought. And that, my friends, brings our episode to a close once more. As always, thank you so much for joining us on this program today. From TrialSite News, I'm Adrian, and I will see you all